KellumMD.com video podcast. Dr. Kellum, you seem a little moody today. Are you moody?
No.
You're not at all? You're not a little worried that tonight is game one? If you're watching this, tomorrow and the Spurs destroy the Knicks, tonight is game one of the NBA Finals. You're going to the game.
I'm going to the game.
And you're excited.
I'm excited.
Are you a little nervous?
Nope.
You're not nervous at all?
No.
What's the Corgi? Are you familiar with the Corgi successfully picking every game of the Western Conference Finals?
No.
Okay, well, this Corgi picked the Spurs in 7. Is that something you agree with?
I think it's going to be in 5 or 6.
Really? I'm thinking the same way, but whenever I say it, all these crazy Nick people come out and say, you're dumb.
And you?
I'm not the smartest pebble in the pond, if you will. But I just
Is that even the right saying?
The sharpest pebble in the pond, I think, is the correct one.
The sharpest tool in the kit?
The sharpest tool in the shed. I don't think you're the cleanest napkin in the pocket. I don't know. We can make anything up we want. This is our show. This is the KellumMD.com.
And that's why brain health is so important, because you don't want to end up like that.
Yeah, so it's funny. And that's what you call a professional segue. We're going to talk about brain health. And, we're going to talk about, first of all, when somebody tells you, as a doctor who's been practicing forever, Dr. Kellum, it's Brain Health Awareness Month, what's the first thing that comes to your mind?
Well, there's a lot to that. So, when we talk about that, you can look at that from, kids playing sports, concussions, those types of things. All of that's an important part of brain health. And then we look at that as people get older in terms of memory loss, worry about dementia, all of that kind of stuff. And so there's a number of ways that I think that topic is very beneficial.
When you talk about, dementia and you talk about Alzheimer's, is that a hereditary thing, or is that something that just anybody who nobody in the family has can develop that?
A little of both. I mean, we see early onset dementia or Alzheimer's in some individuals, and there's certainly some predisposition for familial traits with that. The majority of people are just age-related demential issues, and I don't say that to demean it in any way whatsoever.
Yeah.
It's all very devastating and difficult, but most people get that as they get older. And that's probably the biggest part of what we see here as family medicine. Yeah,
I'm going to bring up my personal, kind of situation with that. My father, my father very well, Joe Farias, very respected, retired state representative, served San Antonio incredibly well. He's 80 years old right now, is as sharp as a tack. You've had recent conversations with him,
yes,
and you guys have gone back and forth. But a couple of his brothers suffered from dementia. Now, this might be more of the myth side of it, if you constantly work his brain. And he had to work his brain from the time he was at CPS Energy as a machinist, a blue-collar guy, to being an executive, to being a school board member, an elected official at the state rep level, coming up with legislative ideas. You're always constantly working your brain. Is the brain like the body, where you need to work it out to maintain that level of health? Or is that a myth?
It's not a myth, but it's not an absolute either. And I think in your dad's case, in that situation that you're talking about, I think some of it is being blessed in terms of not afflicted with it. But I think that the part of what you're saying has a lot of validity. I mean, the problem with dementia for most of us in medicine, specifically researchers, is that they really don't know the reason why. We have speculations in terms of proteins and tangles of the nerves and a number of different things that are the reason why, but some of that has been walked back over the years, saying that's not necessarily the case. We're not really sure always why. When you look at more naturalist and in terms of how you address dementia, or at least prevent it. There's a book called End of Alzheimer's, which is more of a homeopathic type of approach, but it's really kind of interesting because it all goes back to exercise, good dietary restrictions, reducing inflammation, meaning cutting carbs and sugars. Higher protein diets are very helpful, controlling your sugars.
For brain health.
For brain health.
Really?
Exercise, hormonal therapy.
Yeah.
So it's a number of different things that they feel that you need to touch on in order to create that environment to keep people safe and prevent any kind of issues in terms of memory. And I think that's really important. But the problem with that is that that's not the conversation you have when someone who's 73 and coming in with memory issues.
Yeah.
Because it's a little bit past that. So if we had a better understanding, and I think all of those things that I just mentioned are an important part of at least what we try to do to make sure that we can prevent that as best we can. If you can have that conversation with people and get them moving in their early 40s and 50s, the idea that you could prevent some of this from happening down the line is probably legitimate for sure. But the majority of times for people that have family members that may be suffering from that is to get into the doctor and check. We have a number of tests that we can run. Many of them are simple tests, questionnaires, things like that we can really assess where people are in their cognitive ability and understand if it's mild, moderate, severe, which will prompt us to do other things in terms of MRIs and neurologic referrals and things like that, so that we can assess where people are and then kind of move forward with things. But remember, not every memory issue is a demential issue. So sometimes it's a little normal to forget a few things. So, and that's kind of scary, especially if you've had family members that have issues with that.
Therapies. I mean, when somebody comes in and they show signs of it outside of, the holistic things that you talk about, the dietary things, there medicines, are there therapies that can kind of help delay that, if you will?
Well,
and I know that's a tough question.
It is, and I will tell
you
the traditional medicines that have been on the market. There are two that are out there that we've used that I've been a part of using for the last 20 plus years, but they don't really make a big difference in my personal opinion. Now there may be people out there that argue against that, and certainly I respect that. However, I don't see that to be the case. Typically, we haven't found outcomes that are much better. Now, there are newer medicines for mild cases of onset, specifically some immunotherapies that are out there that have proven to be beneficial. To get them to be covered, more mainstream part of therapy, I think is going to happen over time. But there's just not a lot to do from a medicine standpoint that we see a significant difference with, But we do it and we use them, and some people notice some benefit with that. But it's just a difficult problem when people are afflicted with it, and it's tough for the person, the individual, but it's really, really, really hard on the family.
Yeah, one of the things you do that I think just separates this practice from other practices, and there's a million great family medicine practices in Greater San Antonio, is your Kellum Health Diagnostics physical. A lot of doctors, they do the physical where they, do the chest x-ray. They're just a basic physical. You go above and beyond to check head to toe. Part of that is a mental check. And it's a pretty thorough, long 30-minute mental check. I've never seen a physical where you test that. How did that come about? And I think it's a really effective way to at least give you an idea of where you're at.
It gives you a baseline for sure. So, part of the testing looks at brainwave function, reaction times, memory issues, that sort of stuff. So, honestly, they're good things to do. They give us a good baseline. They're early indicators if there are issues that are going on. That, in combination with the exams, in combination with the questionnaires that we have, all give us an idea of where things are at. And so part of our physical is just trying to be thorough and honestly casting a wide net so that we can, if we find something or can find something, then we're able to attack it earlier on. I think sometimes when you're limited in that net, you're not going to be able to get as much information. And so I think for us, as much information is key. So the more we get, the more that is actionable, we can do something about.
Yeah, and I know I work with you, and I know you and I have been friends for a long time, and I'm a big Dr. Kellum fan, but I got to tell you, man, I think one of the greatest things you do is the Kellum Health Diagnostics physical here, because it is a thorough check. Just getting away from the topic, just how you check the body literally head to toe. You can't even quantify and put a number on how many lives and how many things you caught early with that. I would just suggest to everybody, come in if you can and get a health diagnostics physical.
Gabe, we we take our job seriously, and
Yeah.
we believe in prevention, whether it's brain health prevention, which is super important and top of mind, no pun intended, this month.
Yeah, for sure.
But also physical health. That's really important. And so we have developed a nice physical exam that gives us a ton of information. It gives patients a lot of affirmation when they leave that everything's okay. And truthfully, and that's not patting ourselves on the back, because a lot of doctors do the same in terms of catching things. But yes, we have caught a lot of things early on that really afford people the opportunity to be healthy and cure, whether it's a cancer or a heart disease or whatever that
Or a nodule in your thyroid.
or a nodule in your thyroid, so that you can really understand what's happening. And so, we're very excited about that. We certainly would love to help anybody that wants to come in here, but be comfortable with your doctor. If it's something that we have an opportunity to take care of you, we would love to do that. It's always our honor to take care of people. But I think it's important that everybody gets checked to the point that we're talking about today, because all of it is a process. So the more you're in, the more frequent you get your exams yearly. It's really important because you develop that baseline and you understand when changes happen. And it doesn't always have to be the same doctor every year. That, I think, is a better thing to do. However, when you know your body and you're in charge of your health and you understand when there's differences, that's when you can make a difference with things. And so these awareness months that we're looking at, specifically brain health this month, it often speaks more to family, because that's what people worry about. But it's really important to understand that you do make changes today about what may happen in the years to come. And we don't know where that's going to go. Alzheimer's research here at UT, they do a wonderful job in their brain health unit in terms of making advances. So, preparing yourself with good basic health is the way that you can stave off many of things down the line. I think one to include, memory loss.
Dr. Kellum, a great topic. Again, we started with the Spurs. I'm going to end with the Spurs. What a great run for this young, dynamic team. You're a basketball guy. You played high school. You played college. You won a state championship. Have you ever seen a team this young, this good, this early? I've never seen anything like this before.
No. But it starts with
kind of a perfect storm, though,
it
right?
is. But personally, I think it starts with the coach.
Yeah.
He is the...
Can you believe he did not get Coach of the Year, Mitch Johnson? I think that is just one of the greatest robberies I've ever seen.
I think so too, but you know what? I don't think he would ever say anything about it.
No,
he's super humble, but
No.
he's definitely the legacy that to follow a legend like Coach Popovich. I think he is the perfect person for that, to be a legend in his own right.
There you go. Spurs in 5. What's your prediction?
I think it is.
I'm saying Spurs in 7. We got a wager?
Can you wear a different shirt
If I lose, I got to burn this shirt. Is that what you're saying?
That's what I'm saying.
I'm sorry, man. We can't all shop at TJ Maxx like you do, okay? I can't. I don't go to Ross Dress for Less like you do, like you fancy doctors do. All right, folks, that's going to wrap up.
If you don't go
This
for
is
Ross Dress
this is
for Less?
Walmart, bro. All right, that's going to wrap up this edition of the KellumMD.com video podcast for Dr. Remember, 3 locations. We got a location here at Braun, the brand new clinic where you have family medicine and Kellum Women's Health. We've got the location out in Schertz, Texas, where you can get your Kellum Health Diagnostics physical, also the family medicine clinic, and we have our clinic in Bergheim, Texas. KellumMD.com is the website to visit. It's also the sponsor of this podcast. Dr. Kellum, thank you very much.
Thanks, Gabe.
Go Spurs, go. Stay healthy, folks.